Turner syndrome is a chromosomal disorder that exclusively affects females, resulting from the complete or partial absence of one of the X chromosomes. Normally, females have two X chromosomes, XX, but in individuals with Turner syndrome, one X chromosome is either missing entirely, Monosomy X, or altered in some way, mosaicism. This condition occurs in approximately 1 in 2,500 live female births and can lead to a variety of medical and developmental challenges. Causes and types of Turner syndrome. Turner syndrome is primarily caused by the absence of the second X chromosome, which can occur in several ways. Monosomy X. This is the most common form, where an entire X chromosome is missing in all cells. Mosaic Turner Syndrome. In this form, the absence of the X chromosome occurs in only some of the body's cells, while others may have the usual two X chromosomes or even other chromosomal abnormalities. Partial X chromosome deletion. Some individuals may have an incomplete X chromosome, where part of the chromosome is missing. Ring chromosome. In rare cases, one of the X chromosomes forms a ring structure due to the loss of both ends of the chromosome. Diagnosis, prenatal diagnosis. Turner syndrome can often be suspected before birth during routine prenatal screenings. Prenatal cell-free DNA screening. This test, performed on a maternal blood sample, can detect the likelihood of chromosomal abnormalities, including Turner syndrome. Ultrasound. Certain physical abnormalities, such as fluid accumulation, edema, or heart defects, might suggest the presence of Turner syndrome. Postnatal diagnosis. After birth, a diagnosis is usually confirmed through a karyotype test, which analyzes the chromosomal composition of the individual's cells. If Turner syndrome is suspected during infancy or childhood, the karyotype test can confirm the diagnosis. Medical and developmental challenges. The effects of Turner syndrome can vary widely, but they often include short stature. One of the most consistent features of Turner syndrome is short stature. Without growth hormone treatment, the average adult height for women with Turner syndrome is around 4 feet 8 inches, 142 cm. Gonadal dysgenesis, ovarian insufficiency. Ovarian development is often impaired, leading to incomplete sexual development, infertility, and an increased risk of gonadal tumors in some cases. Most women with Turner syndrome do not undergo normal puberty without hormone replacement therapy. Cardiovascular issues. Heart defects are common, particularly bicuspid aortic valve and coarctation of the aorta. These conditions can lead to serious complications if not monitored and treated properly. Kidney abnormalities. Structural abnormalities in the kidneys occur in about 1/3 of individuals with Turner syndrome, potentially increasing the risk of urinary tract infections and hypertension. Hearing loss. Many women with Turner syndrome experience some degree of hearing loss, which may worsen with age. Thyroid disorders. Autoimmune thyroid disease, particularly hypothyroidism, is more common in individuals with Turner syndrome. Bone and skeletal issues. Turner syndrome can lead to skeletal abnormalities such as scoliosis, curvature of the spine, and osteoporosis, weakened bones, especially if estrogen levels are low. Learning difficulties. While most girls with Turner syndrome have normal intelligence, some may experience specific learning difficulties, particularly with spatial reasoning and mathematics. They may also struggle with nonverbal communication and social interactions. Vision problems. Turner syndrome is associated with an increased risk of vision problems, including strabismus, crossed eyes, and amblyopia, lazy eye. Management and treatment. Medical care. Turner syndrome requires a multidisciplinary approach, often involving endocrinologists, cardiologists, nephrologists, audiologists, and other specialists. Growth hormone therapy. This is often prescribed during early childhood to help achieve a taller adult height. Estrogen replacement therapy. Starting around puberty, this therapy helps to induce the development of secondary sexual characteristics, such as breast development, and supports bone health. Fertility treatment. Although most women with Turner syndrome are infertile, assisted reproductive technologies, such as egg donation, can enable some women to conceive. Regular monitoring. Ongoing medical care is crucial for managing associated health risks, such as cardiovascular monitoring, thyroid function tests, and bone density assessments. Psychological and social support. Girls and women with Turner syndrome often benefit from psychological counseling and support groups. Social support can help address the emotional and psychological challenges associated with the condition, such as dealing with differences in height, sexual development, and infertility. Prognosis and quality of life. With early diagnosis and appropriate medical care, most girls and women with Turner syndrome can lead healthy, independent lives. Regular medical follow-up and adherence to treatment plans are essential for preventing or managing complications. When to seek medical advice. If there are concerns about Turner syndrome, such as unexplained short stature, delayed puberty, or other signs, it's important to seek medical advice. A referral to specialists, such as a geneticist or endocrinologist, may be necessary for further evaluation and management. Research and future directions. Ongoing research is aimed at better understanding the genetic basis of Turner syndrome and improving treatment outcomes. Advances in reproductive medicine, gene therapy, and personalized medicine hold promise for addressing some of the challenges faced by individuals with Turner syndrome.